So the mission of our SIG is to improve our understanding of refractory headache, to advance treatment options for our patients, and of course to advocate for optimal care of patients who have severe and refractory headache. So I'm really excited as we've got a whole bunch of different projects going on. So there's actually 4 of them. Previously, this section was chaired by Dr. Mia Minen. And so she's got a great one going on where she's looking at surveys of local emergency care for status migrainosus. We've got 2 separate systematic reviews that we're doing that are kind of going in parallel to one another. One is to try to identify whether or not we've properly defined and understand what status migrainosus actually is. So one of the limitations in treatment is that status migrainosus requires you to have a headache for 72 hours, but we have almost no research on that because no one's going to tell a patient to wait 72 hours when they show up in the emergency room. So we're trying to understand, is there a better way to define it, which will then lead to better research and hence better treatment options. And then on the other side of it, we're trying to do a systematic review of what are the current treatment options as best we understand them. And then finally, we're going to be doing a survey of the AHS membership to see what their current real-life approach to status migrainosus treatment is. We're dealing with a part of headache medicine that I think a lot of us are passionate about, and I know it's my personal passion. We have patients who are refractory to treatment, and we don't have great understanding of what works best for them. The reality is a lot of the studies aren't enrolling our most refractory patients. So often we're using studies based on less refractory patients to really guide us. We don't know what to do for status migrainosus. We don't have great studies or guidelines. So there's so much research and so much better understanding that we really need to improve. And so that's where I get really passionate is, you know, I have this patient in front of me. They don't really fit what the evidence is based on because they're that refractory patient population. You know, they've tried 20, 30 medications. What do I do next? I don't want to give up on them and I'm never going to tell them that. But I'd love more evidence, more science to really tell me what to do and what's different about this patient. Why aren't they responding? And so that's where this section gets really excited is, you know, what can we do in terms of effusions? You know, when they show up in the emergency room, what is the best treatment? Is there workup that we need to do? Are there going to be biomarkers that tell us how to, you know, guide care for these patients? So there's just so much that we can eventually do from here. And so the goal is to really advocate and try to help direct those next steps and also have a group that we can get excited about that so we can really help that future.